Good evening. I'm Senator Liz Krueger. Welcome to everyone. Tonight's town hall, Thursday, May 27th, will be on benefits, healthcare, and nutrition, which impacts all of us. So I'm glad that you can be with us here tonight. We will have a lively discussion and presentation by two experts, followed by questions and answers as we usually do. I'll just start out with a general introduction and some updates, as I always do. Of course, you are all welcome. Some of you may be on the phones, in which case you have to stay on mute. Others may be on Zoom or Facebook, calling into the town hall discussion this evening. And I want you to know that there is closed captioning available as a viewer if you have Zoom or if you are on Facebook. On Zoom, you can click in live transcript in the meeting controls to start viewing closed captioning. And on Facebook Live, you'll see a setting button in the bottom right-hand corner of the video. Click closed caption CC to start viewing the closed captioning. We have found this is so helpful for so many people who may not actually have completely lost their hearing, but are having more trouble hearing, which is natural as we age. And so it's very handy to know that the computers that we use are offering us new advantages, such as closed captioning. Before we actually get to our guests, I want to remind everybody primary day is coming, June 22nd. Please remember to vote in the primary, but you must be a registered Democrat or Republican. You got to pick a party for primaries. If you're not already registered to vote, you only have until tomorrow, Friday, May 28th, to register your party participation. Please consult vote.nyc for information on how to register, as well as details about early voting and election dates, times, and poll sites. We really have three successful ways to vote in the city. You can vote through a mail-in ballot. You can vote early, up to 10 days early, at multiple sites around the city, or you can vote on election day at your poll site. We'll be posting the link in the chat to let you know how to learn about any of these options and what to do if you still are going to try to register by tomorrow. On Tuesday, the state announced that applications for the Emergency Rent Relief Program will be available beginning June 1st. That's right around the corner. You're going to see a link in the chat from the Office of Temporary and Disability Assistance, the state agency that is responsible for administering the rent relief program. You're going to find guidance about program eligibility and the documents you'll need to complete your application. If you're on my email system, you will also be getting, or you should have actually gotten today, I believe, a notice explaining this whole process to you, including what groups are providing application assistance. We're talking about potentially 500,000 people applying for emergency rent relief within a month. So there's going to be a lot of activity. We want to make sure nobody gets closed out of this possibility. And it really is a program that runs until the money is spent. So you don't want to wait. You don't need to panic, but you want to make sure you get that application. And if you don't understand how to fill it out, you're turning to your elected officials. You're turning to the agencies that have been contracted to provide application assistance to you to make sure that you get the funds you need to help paying back rent that you may have discovered was a crisis for you during the last 14, 15 months of COVID. Landlords should also learn about it because there's a way for landlords to apply and certainly for them to be helpful to their tenants. And there's every reason for a landlord to want to be helpful because they're going to get the money. You apply, but the money goes to the landlord. So just know that this is a program where as much cooperation as we can get between tenants and landlords, the more successful we will all find the program to be. Jumping to COVID-related matters, this week is the time to get ready for the July 4th holiday by getting vaccinated so you can celebrate safely with friends and family. I have told you a million different reasons and why you should get vaccinated. We've discussed it, I don't know, ad nauseum over these town halls. I was just pointing out there's a lot of different offers that are being made to encourage people who haven't yet gotten vaccinated to get vaccines. I think they were offering baseball tickets here in New York City, train tickets on the Long Island Railroad, metro tickets. I was talking to a colleague from Buffalo who said they were offering beer. And people just ran to line up, get a free beer and get vaccinated. I'm a little worried that that's actually the level we're all at, but you know what? If you want to be vaccinated, if you get a free beer, I can figure that one out for you also. We need everybody vaccinated. The city and state are offering a variety of incentives, as I just said. The age has gone down to 12 years old. So we want to be making sure that our teens are getting vaccinated. And we're even hearing that we'll be going younger than 12 fairly quickly. Additionally, New York City is expanding eligibility for in-home vaccinations for people who are homebound. All New Yorkers 75 or older and all New Yorkers who are medically disabled could be eligible for someone to come to their home and vaccinate them. If you're interested in that option, there's an in-home form that you can get from the internet, nyc.gov/homebound, or call 877-VAX for NYC, the number 4, VAX for NYC. All the references that we're making to locations, phone numbers, websites will be in the chat, and also will be sent out to people who we do have the emails for. So you always want to make sure you're registered and that we know who you are, because then you get the follow-up materials. And now I want to move us over to the topic of the evening. You should know this event is being recorded, and that you might let people know that they can listen or watch at their own discretion after tonight, because it will be up on my website as well on Facebook. So, as a result of COVID, many of us are experiencing financial difficulties for the first time and may be struggling to find affordable healthcare options for ourselves and for our children. So we've invited benefit experts from the Community Service Society to join us to discuss healthcare options offered through the Affordable Care Act, how to find out about them, and how to apply. We're also going to be doing an overview of eligibility for the SNAP program, which some of us used to know as the food stamp program, and other nutritional benefits. The information provided to us tonight will give you a general overview of your healthcare options, but may not answer your specific insurance questions. We will post links to more specific information in the chat and share telephone numbers to one-on-one counseling services to meet your individual needs. None of the information or numbers that we put out there are for profit or charge. We only direct people to recognized, approved, government-sponsored or not-for-profit organizations. Now it is my pleasure to introduce two expert presenters from CSS, the Community Service Society, Michelle Berney, the new director at the Benefits Plus Learning Center at the Community Service Society, and Leslie Bailey, the director of training at the same organization. After their presentations, I'll moderate a Q&A portion of the event, and you can submit questions through the chat function on Zoom or Facebook. And now I will turn the proceedings over to Michelle and Leslie and come back on screen when we're ready for questions. Good evening, ladies.
Thank you so
Bye.
much, Senator Krueger. Thank you.
Great.
All right. So we're going to get started with our presentation. I think, if there's one thing to walk away with tonight, it's really that this is like a little bit of a crash course in health benefits and about some food programs. But really what we want to do is make sure that you know that there's a door open so that you know where to go for follow-up information, because this is a pretty lofty agenda for what we're going to go through. So starting off on the health front, just to run through what I'm going to be speaking about, I'll be speaking on Cobra continuation coverage, and then I'll move on to different programs through the Affordable Care Act, which is known by different names like the marketplace or the exchange. The term I'll use is the marketplace. And the programs within the marketplace that I'll be discussing are Medicaid, Child Health Plus, the Essential Plan, and Qualified Health Plans. And then we'll move on to a short discussion on Medicare and then other programs available for people who are uninsured or underinsured. So to start off with Cobra, just for starters, Cobra is continuation health insurance. And this is really for people who have lost their work-based health insurance and want to continue with that same health insurance. And so Cobra is available to the worker themselves, their spouse, dependents, etc. And the way that Cobra works is that you, as the former employee, pay the full cost of that plan. So many people get subsidies for their health insurance when they're working. If you're on Cobra, you're paying the full cost of that coverage, as well as an administrative fee. So why would you want to have Cobra? Well, for many people, they need health insurance. And also for many people, they're comfortable, like they understand how that coverage works. And so it can be a very attractive option. But the downside is that it's very expensive. And so for many people, that's a barrier. I'll be speaking in just a moment about a special provision that's available very shortly, but quickly, just a red flag for people who really should not enroll in Cobra, and that's for people who are 65 and over or who are otherwise Medicare eligible. And so I just want to put that forth, because if that is your situation, you should seek guidance to understand what to do. So moving on, a provision, thank you, for during the public health emergency, a program that's going to be, that's happening now is that the IRS will allow for Cobra premium assistance. This assistance is available for people who lost their health insurance involuntarily, and it's only for a 6-month period of time. So this support is only available from April through the end of September. So for all or part of those 6 months, if you could be on Cobra, the IRS can provide some support to pay your employer, your former employer, those premiums. And so if that's something that would be useful, that's something that you can explore. Note that it is not available to people who are eligible for other group health insurance or for people with Medicare. And again, like it's really this short 6-month period of time. So it is something very temporary, but it is an option. So what I'm going to shift to now, and where I'll spend the bulk of the time with you tonight, is speaking about the marketplace. So with the Affordable Care Act, what New York State did is they established this marketplace. It's what it calls. That's what New York State calls it. And what the marketplace is really like a single entry point for many individuals and families to get health insurance. So you can get different health insurance products depending on your income. You'll be available for different types of insurance. There was somebody who submitted a question prior to tonight, and so I'm just going to highlight one point of information on this, and that was regarding small businesses, because there's a small business marketplace through the marketplace, and that allows businesses with between 1 and 100 employees to purchase health insurance through the marketplace. So our focus for tonight is really on individuals and families, but I do just want to point this out as a resource and where you can go for more information on that. Okay, so on this slide, it's I tried to snazz it up a bit to make it feel a little bit more accessible. But this is really a breakdown of the different types of insurance that are available on the marketplace. So when you reach out for assistance or when you're applying for health insurance on the marketplace, oftentimes one of the first questions, which seems invasive, I know, is about your income. And why that is because you're being screened to see whether you're eligible for any programs that make you eligible for free or reduced cost health insurance. And so the first one that you're being screened for is Medicaid. Medicaid is free health insurance for people regardless of any age, but typically on the marketplace, it's for the under 65s. For the income limit, they cap it at 138% of the federal poverty level. And I wrote down some of the income limits, but what that translates to is about $1,481 for a single and $2,083 per month for a couple. Okay. Now for children 0 to 18, for families with households under 400% of the federal poverty level, those children may be eligible for Child Health Plus. And this is subsidized health insurance. And the premium would be somewhere between 0 and 60, and it really depends on the household's monthly income. But where Child Health Plus is interesting is that it really hits people at higher income limits. And so what 400% of the federal poverty level works out to be is roughly $8,833 per month for a household of 4, just to kind of give you a little bit of a benchmark there. Okay, and it's very comprehensive health insurance for children. Now, I'm going to focus a little bit more on adults for the moment. For those adults who don't qualify for Medicaid, but they're still low income, they would then be screened for the essential plan. This is for individuals ages 19 to 64, and it's for people with incomes up to 200% of the federal poverty level. Now, typically, when I say typically, what I'm saying is during non-COVID times, the essential plan is kind of broken out into 2 different premium subsets. One is free and one is $20 a month. And starting on June 1st, and this is a COVID provision, all essential plans will be 0 premium per month for adults who are eligible for the essential plan. Okay. And then we move on to like the bulk of the marketplace. And this is what I think many people are most or somewhat familiar with. And these are the qualified health plans. And this is available to people regardless of your income and regardless of your age. Anybody can purchase a qualified health plan. Where we talk about income with qualified health plans is to determine whether somebody may be eligible for a premium for a tax credit to help offset the cost of that qualified health plan. Okay, and how much you would have to pay would depend on many factors. Of course, it would depend on your income. It would depend on which plan you select, which I'll be speaking about in just a moment, but just a word on all health insurance that you would be able to purchase on the marketplace is that all of the insurers offer insurance products that are in-network benefits only. And so what that means is that when you select a plan, you'll want to be mindful to select a plan that allows you to see your providers and use the hospitals that you want because they're in the plan's network. So while there are rules, there are always exceptions to rules, but the general rule is that it's in-network benefits only, with the bigger exception being in case of emergency. Okay, so we're going to focus a little bit more on qualified health plans now. So one of the interesting parts of these qualified health plans discussions is that the different health plans available on the marketplace are broken down by metal tiers, literally metal tiers: platinum, gold, silver, and bronze. Okay, and it's why you have those metal tiers is really it's like an actuarial issue, with platinum being your most comprehensive policy. And by comprehensive, what I mean is that you would, at the point of service, you would have the lowest copays or co-insurance. Okay. And then with something like a bronze plan, you would have higher copays, higher cost sharing at the point of service. Okay, I hope that makes sense. So many people make, I'll just throw out some examples. Some people have gotten used to paying like $20 or $30 or $40 every time they go see their doctor. So with a bronze plan, your cost sharing when you go to the doctor may be higher. And with something like a platinum plan, it would be lower. Okay, so, but your cost sharing, how much you're paying for the plan is going to vary to a large extent on which metal tier your plan falls. I hope that that's clear. There's a lot to this. Okay. And again, people with incomes up to 400% of the federal poverty level may be eligible for premium tax credits. And what that does is it offsets your premium. So you would be able to pay a lower monthly premium for whichever plan you select. And that the amount that you would be able that you would be credited would depend on your income. New York State of Health, NY State of Health .ny.gov is the website to go to. And on that website, there's a calculator, and it allows you to input information like your household size, the number of adults and children in your household, and your household income. And by including that information, it gives you an estimate of the amount of the premium tax credit that you may be eligible for. So that's sometimes a really useful tool. And from there, you can see the different plans available in the area in which you live, all the different metal tiers and the different insurers. And I'll be talking about ways that you can get help, because this seems I know it's daunting. Starting on June 1st, so in a couple of days, the American Rescue Plan will make it so that higher income individuals and families may be eligible for the tax credits as well. So kind of taking it above and beyond that, the households with 400% of the federal poverty level as income. So really I've tried to find numbers for what that upper income is. And the most specific that I can find is that the law is really designed to cap the percentage of someone's income that they would pay towards health insurance at 8.5%. So there's not that much out there yet on this, but this is something that's coming down the pike next week. And for people who don't qualify for premium tax credit, so higher income individuals, you are eligible to buy a qualified health plan, and you would pay the full price. So that's an option as well. So I hope, if we think, really just, I think of it as like a tunnel almost. And, where are you getting off to get whichever health insurance plan you're eligible for? That's how I envision the marketplace process. If you can, so one other type of coverage, and this is a little bit more of a smaller provision within the marketplace, is this catastrophic coverage. So when we talk about catastrophic coverage, what I'm talking about is health insurance that you buy for the just in case, so really to shield you from catastrophic health insurance, from catastrophic medical costs. So certain individuals, not everyone, but certain individuals are able to purchase such catastrophic coverage through the marketplace. So the way these catastrophic plans work, very generally speaking, is that the policies are offered at a much lower premium, but they have much higher deductibles. So before the plan would cover you for the cost of care, you have to pay a certain amount first. So you can see what the deductibles are on this slide, about $8,550 for a single individual and over $17,000 for a deductible per family. So you can see that while the monthly premiums may be lower, you can have higher out-of-pocket costs in the event of a medical event. Some notes on these that I think are important to highlight. The first is that premium tax credits are not available for use on these catastrophic plans. Also, preventive care is covered at no cost, so you wouldn't need to meet your deductible before your catastrophic plan covers you for services. And the general rule on who can get these plans is that typically it's for people under age 30. Okay, so I just want to kind of put this out there because people have asked over time about catastrophic coverage, because sometimes those qualified health plans, even with a subsidy, may seem a little bit outside of someone's range. Okay, it really varies from person to person. So a little bit more on marketplace coverage. How do you apply, right? And when I say apply, I'm talking about also how do you get help? So there's a network of people called navigators, and navigators can help review your eligibility for the different marketplace plans and guide you with the selection of a plan, right? Because if what I said seems really dizzying, you're spot on, like you're understanding it, okay? It is confusing. There's not a lot that's intuitive about this, but for navigators, this is what they do day in and day out, and they can break it down for you and review your specific situation, your financial situation and really guide you through the process, right? There are many insurers, many options. And so to have somebody to help focus you can be really helpful. And navigators don't sell anything. So the navigators at the Community Service Society, they work with a program called Community Health Advocates. They're not representing any insurance company. So they're really going to be able to give you that objective information that's spot on for what you need. So when can you enroll in marketplace plans? Well, for people who are eligible for Medicaid, Child Health Plus, and the Essential Plan, you can enroll at any time of the year always. That's how it's been. For the qualified health plans, the way it's typically been is that you can only enroll during the annual open enrollment period, unless you've had a qualifying event, like losing other health insurance coverage, for example. However, one of the exceptions due to the public health emergency is that New York State has kept the marketplace open for enrollment through the end of December of this year, so 12/31. And so if this is something that you're interested in exploring, that timeline shouldn't be a barrier, right? So it's really open and accessible, and the community health advocates are available to assist you with that. Thank you. So a quick note on Medicare. Medicare's federal health insurance, primarily it's for people 65 and over, also for younger people who have been collecting Social Security disability insurance for 2 years minimum, and also for people with end-stage renal disease or kidney failure. And also there are citizenship and residency requirements to be eligible for Medicare. The main one is that you have to have been, if you're not a citizen, you have to have been a permanent resident for minimum 5 years to be eligible for Medicare. A quick note, because someone put this forth in a question prior to tonight, is that if someone is not yet eligible for Medicare because they don't have those 5 years, they may want to explore Medicaid or even a qualified health plan as options. And I would really seek guidance from a navigator, from someone else who's able to walk you through that process. The majority of people are well advised to enroll in Medicare when they're first eligible. And that's really to avoid any delayed start date, any potential late enrollment penalties. And the big exception to that group of people is people who are working or who have a spouse who's still working, and they have health insurance through that current and active employer. Okay. But I would really always recommend that someone, if you're approaching Medicare age, I would really recommend that you speak with somebody just to make sure that you understand exactly how things should be working for you and what you should do at the time that you're losing that work-based insurance. Okay, so I put really a strong emphasis on people kind of owning this and taking matters into their own hands so that you understand where you're at and when you need to kind of switch gears and make a change to your coverage. Also, another reason to get connected to some good people who can help you is because there are choices in how you get Medicare, right? So there are really two main choices. I know from advertisements that it feels like you have hundreds of options, but really it's either original Medicare using the red, white, and blue card for hospital and medical coverage, or you're in a Medicare Advantage managed care plan. It's one way or the other way. Okay, and you can make changes. It's not a forever decision. There's through the Benefits Plus Learning Center, there's a way that you can get information on this and also learn about programs to help save you money on your Medicare costs, because there are some programs available that may be helpful to you, and if not to you, maybe to someone who you know. And on the next slide here, and I'm really just going to touch on this because this is like opening a can of worms in a discussion, but it is possible to have both Medicaid and Medicare, okay? And also one of the things that we know has been very confusing for people are people who have had Medicaid on the marketplace and then become Medicare eligible. And it's confusing always. And things are working a little bit differently now because of COVID. And so the phone number is on the slide, and I know it's put into the chat, but the Public Benefits and Housing Information Line, people there can explain this to you so that you know what it means for yourself. Okay, and I can't stress that enough, because I can talk generally, but until you really understand what it means for your specific situation, it's a little more theoretical, and I want to make it personal. Okay, so The last thing that I'm going to speak about before turning it over to Leslie is just putting forth that there are programs available to people who are uninsured, meaning they have no insurance, and people who are underinsured. And what I mean by underinsured is that you have health insurance, but maybe it doesn't cover all the services you need, or maybe you have high cost sharing, you just can't afford it. Okay, so 2 resources. One is our local hospitals, and I put the phone number and the link on the slide. And also the federal government has these federally qualified health centers, and these FQHCs, federally qualified health centers, allow people to access care in the community and pay on a sliding scale. So there's a website here where you can put in your zip code, your area. I think it actually even pulls up your location if you allow it, and you'll see a listing of centers there. So I threw a lot out at you, and again, if there's one takeaway, it's if you have questions on health insurance or need access to health insurance, call. Okay, so with that said, I'm going to turn it over to Leslie. Thank you, Leslie.
Thank you. Good evening, everyone. So my piece is about accessing health SNAP coverage. So with SNAP benefits, as Michelle was, just to echo a little bit of what Michelle was saying, this is not going to be a comprehensive training on, SNAP benefits, but it's enough information to give you some concrete information and some examples, as well as the ability to apply for this benefit. So SNAP is a federally funded benefit. It allows low-income households to purchase food at participating grocery stores. So it can be the supermarket, it can be, and even be the farmer's market. So in addition, SNAP can also be used online to purchase groceries from participating partners. So you have Aldi, Amazon, Price Chopper supermarkets, Walmart, and ShopRite. And on the screen here, you see a picture of an EBT card. And this is how one would access their SNAP benefits. So we get asked a lot about who needs to be included in a SNAP household. And SNAP rules are very different than other public benefit programs. SNAP rules define a household as a group of people who indicate that they purchase and prepare meals together. However, certain family members who live together must be considered a SNAP household, regardless of whether they purchase and prepare meals together or not. And these individuals include spouses living together, parents and children under 22 residing with their parents, children under the age of 18 under parental control. These are children that are not your own. This can be a situation where you have perhaps an older sibling caring for their younger siblings, or you have an aunt caring for nieces and nephews. So that particular household situation, SNAP will mandate you to be one household until those children are 18 years of age. And then at that point, those children can continue being part of the SNAP household, right? They purchase and prepare meals, or they can have a separate SNAP household purchasing on their own. There are additional criteria for SNAP, but again, kind of like what Michelle says, it's very individual, but there are income, resource, and immigration criteria that may apply to certain households. And we definitely urge you to contact the Public Benefit and Housing Information Line to help you understand your particular circumstances, do a SNAP budget with you over the phone, and give you an estimate of what you might be eligible for. And again, we don't work for the government. These are volunteers that you talk to who are well-versed in public benefit information and can really help answer your questions. And so we typically provide information about how much you can get in SNAP benefits by providing our free SNAP calculator. So this is a statewide calculator, and this is the link that you see here on my screen. I'm afraid to click on it because it might freeze everything. So I'll just have them push out this website for you. But the great thing about this website is that in the privacy of your own home, you can click on it, you can answer some questions. There are these little question marks that guide you throughout the calculator, and you can get a sense of how much you might be eligible. And if you have questions, again, give us a call and we can do the budget with you over the phone. There might be a mistake that you made in calculating a budget, but it's a really nice tool to give you some options and to give you some ideas about, is this a benefit program I want to apply for. There are really big budgeting advantages for members who are elderly or disabled. Elderly is defined as 60 years of age or older. I did not make that up. This is the rule. That's their definition. Disability are individuals in receipt of a disability benefit, whether it's from the VA, whether it's from Medicaid, Social Security, SSI, etc. So SNAP is not going to do a disability determination. You have to have been certified by another entity. This is some information and ways to apply for SNAP benefits. You can download a paper application. You can go online. Now with COVID, there aren't that many local SNAP centers open here in New York City, and I'm sure outside of New York City as well. You can call here in New York City, the HRA info line there, do an application over the phone. We've given you a link to an application. And to submit it, you can also submit it with a community-based organization. So there are certain community-based organizations who will sit with you, do the application, send that in. You can provide the documents that you have on hand and they can really help you. Or if you want to submit the application on your own, you can do that through Access HRA. It's an online portal, or by fax. Even though there are I think there's 6 or 7 local SNAP centers open here in New York City, you can also do that in person if you choose, if you're comfortable. And again, the big box, give us a call if you have any questions. I also wanted to throw in 2 things. So I have 2 slides on pandemic EBT. So I'll do that. And then I also wanted to go online and show you additional resources, because one of the things that I really want everyone listening to take away is it is overwhelming, but there is information out there. It's accessible. And so that's what I want to end my presentation with. So let's talk about pandemic EBT first. So pandemic EBT, or PEBT, one of the things I wanted people to understand is that it's administered by the state, not the local Department of Social Services. So any questions that you have regarding PEBT, you have to go through the state. The program issues a supplement to households with children who would otherwise have been eligible and receiving free or reduced cost meals. So this supplement in the 2019-2020 school year was issued on an EBT card. And I really want to emphasize that PEBT is not SNAP benefits. This is a completely different benefit program, but it is being issued on an EBT card. So for the 2019-2020 school year, households were issued a one-time benefit of $420 for each eligible child, which covered the months of March through June. And there's some additional information that you can click on to get what the distribution was, because there was a distribution calendar, when people got it, what happened if you didn't have an EBT card, how could you get it? So all of that information is contained here. As I said, it's different than SNAP benefits. It's a completely different benefit program. There's no income or resource or immigration criteria to get pandemic EBT, and there's no application process. Basically, the state identifies eligible households through a system, and once the household has been found to be eligible, the state will process them getting the card to access the benefit. Now, in New York State, PEBT has been approved for this current school year, the 2020-2021 school year, and it actually expanded to include younger children who might have received meals at a daycare program, but it was closed due to COVID or reduced operating hours. However, there have been, it's the end of May, still no information. And so I gave you the New York State OTDA FAQs. If you have any additional information on their website, there's also an email if you want to reach out to them. Perhaps you were in the 2019-2020 school year and this is the first you're hearing of it. You think you might be eligible. I would, contact the state right away if you find that this is a benefit you missed out on. Then the last thing that I wanted to go over, I wanted to visit our website. We have lots of COVID-19 information, and that's this last bullet here. So if you bear with me, I think I have it already loaded. Yes, it is. So this is our website, and this is where you can find additional information on a lot of the COVID-19 changes that have been happening. So I thought this was a nice resource to kind of end with, because it is a lot of information. I mean, in March, when we began to work from home, information was coming in so fiercely. And thank goodness for Senator Liz Krueger's emails, keeping us all up to date. We were combing through absolutely everything. So here on our Benefits Plus website, we have this tab here. I hope you guys can see it's COVID-19 resources, and there's lots of different resources, and we've kept as much as possible up to date with all of the information that has come out. And so if you click on food access programs, this is the information that I just talked about, but you're gonna find the details here under the pandemic EBT. So when you click on that link, it's information. So again, you don't have to feel so overwhelmed. When you're ready to sit down, when you're ready to look up information, you have that here in your fingertips. And this gives details that, you know, in 40 minutes, we're just not able to do. Okay, changes in SNAP. And if I could just call your attention to this new section that we added, it's called utility assistance. And one of the things that we have under utility assistance is the emergency broadband benefit, which a lot of people have been talking about. You can click on that, get additional information. So lots and lots of COVID-19 information. So I just want to show you. So that's PEBT, green markets, food pantries, meal programs, lots and lots of information. So I hope that the takeaway is that you don't feel extremely overwhelmed with all of the information that's out there, because it really is very easy to do. Information is changing, coming at you very quickly, and finding out where it is the next best thing.
All right. Well, thank you both, ladies. That was terrific.
Woo.
And yes, I know it's a lot of different information to absorb. And when I was just listening to Leslie talk about SNAP, you know, I used to, before I was a senator, run an anti-hunger, anti-poverty organization. And I was the SNAP expert, or the food stamp expert. And the program's title has changed, but I think some of the really important things to remember about SNAP haven't changed. So one, people used to feel stigmatized about using food stamps because they were coupons that came in the mail, and you would have to put them on the counter at the supermarket and count them out. And people would go, oh, they're on food stamps. Well, here's the thing. The EBD card, to be honest, looks like 14 different credit cards people pull out of their pocketbooks. So everybody shops at supermarkets with a credit card. So whether it's an EBD card or a credit card, no one's going to really know what you're shopping with, but it's additional money for your family for good, healthy, nutritious food. It's also 100% federally paid for. The EBT program for children in school is also, which means every time we draw down more EBT, SNAP, or pandemic benefits, we're bringing federal money into our local economy. And it's going immediately into our local economy because it gets used at food stores and farmers markets. So think about it this way. You can help yourself and your family eat better and more nutritious food, have more money available for the other family needs that you may have, whether you're an elderly person living by yourself or a family with children. And know that just by doing this, not only are you getting better nutritious food and helping your budget, you're also increasing the number of people who get jobs at our local neighborhood food stores. And you're increasing the number of people who get jobs moving food into New York City from where it's produced or grown. And you're increasing the number of jobs New York farmers need to remain there for us. So I think of as SNAP and the federal benefits particularly as basically, it's like buying war bonds. It's patriotic because you're helping everyone, including yourselves. And people never think twice about taking their Social Security when they hit a certain age, or taking health insurance through Medicare. And if you ask them why, they'll go, well, because when I was a taxpayer, I paid for them. Well, this is the same story. You might not be a taxpayer anymore, but you were, or you might not be a taxpayer this year because so many people lost their jobs in COVID. And so that's exactly why we need these programs now more than ever. And people who never imagined that they would be participating or even needing to learn about these programs, I'm hoping are listening and say, wow, this might be exactly what I need. So again, tonight, food, healthcare. Tomorrow, you're going to go and apply for emergency rent money, or June 1st, sorry, it's not quite tomorrow, very soon, to help you pay your back rent and help your landlord get the rent that they need. So we have enormous opportunities here, but it does involve taking some steps and learning some things we might not have known before. But as you can see from CSS and from the resource lists, and if you call my office, we of course will be helpful. There are many, many different locations that can help walk you through these benefit programs. With that, I'm going to start to ask the questions that I got earlier. We'll see about whether more come in from chat. I guess we're starting back with Michelle, although I guess either of you can answer as you wish. Must you get Medicaid at 65, or can you get some kind of less expensive option on the ACA?
So that's a great question, and slightly nuanced. So I'm going to speak about like 99% of people, which is that most people who turn 65 would be really well advised to enroll in Medicare at 65. And the big exception to that are people who have work-based health insurance, either through their own employment or through a spouse's employment. And it's got to be a spouse, not a domestic partner. Okay. And that's really like the big group of people who are allowed later on a special enrollment period to pick up Medicare past 65. Now, and I want to really focus on the cost structure, because there are programs that can help people with limited incomes who are Medicare eligible. So there are programs, the name of the program is really like the Medicare Savings Program, that can help people with the Part B premium assistance. So rather than have your Part B premium deducted from your Social Security check, it can be reinstated. So in essence, you're not paying it. And that's really a very important benefit on the Medicare Part B side, which kind of overflows into automatically being eligible for Part D assistance. So you can get help on the drug side. Now, there's a very small group of people who may in fact want to get a coverage through the marketplace after 65, but it's really for people who don't have the residency requirement, and also for people who don't have a work history to qualify for premium-free Medicare Part A. So it's a very tiny number of people. But if that's a question that you have, and it's an important one, I would really somebody about your specific situation, because it may be worth just having a more in-depth conversation so that you can make the best decision for yourself, really, when it comes to Medicare for the short term and also for the longer term, because delaying enrollment in Part B can have important consequences, really, by way of late enrollment penalties and not being able to get the coverage when you want it.
Thank you. Mm-hmm. Okay, sticking with healthcare, this is an interesting question. This is from a small business. How can small businesses get affordable healthcare for their employees, their families, and even the owners? My employee keeps her kids on the New York City Child Health Plus program because it is better and cheaper health insurance than the plan I offer through my business, but I'm paying $400 per month towards her premiums for, I guess, health insurance she's not using because Child Health Plus is better. What do you recommend to employers of how they get advice about what the best options that are cost effective are for them?
Yeah, I would recommend, so on one of the slides, there was a phone number, there was a click through for help on getting assistance through the marketplace for small businesses. So I would check with that to see if if there's any support that can be available through that.
Great, thank you. We'll stay with healthcare for a little bit more. I've lived in the US for 4 years. I'm doing my first tax filing was in 2019. I'm over 65 and am presently employed. My wife and I are uninsured. What are our options?
Okay.
Are they eligible for Medicaid yet? They don't have enough quarters?
So when we talk about Medicare,
Medicare, I'm sorry. Yeah.
That's okay. That's a very, it's a very they're commonly confused terms. It's all good. So for Medicare, like number one, you've got to be 65, and two, where we talk about it's those 10 years or 40 quarters of work history that make you eligible for that premium-free Medicare Part A. But the kicker, and this is what I think applies to the person who presented this question, is the 5-year residency requirement. And so they're not eligible for Medicare at this time. And because they're not Medicare eligible, that would be that's a really good example of somebody who may want to reach out to a facilitator, to a navigator rather, for assistance in exploring a qualified health plan. That person may also be able to apply for Medicaid. And what's interesting about Medicaid for people who are 65 and over is that for people who have earned income, as this person does, have very generous income deduction. So in essence, they look at much less of your income than you earn. There are very generous disregards. So again, like that's somebody I would say, give a call to a navigator, give a call, because Community Service Society is very well equipped to help people kind of across the range of ages and immigration circumstances and incomes to really figure out where they fall. And if they fall in more than one place, what are the advantages or disadvantages?
I was thinking they might be eligible for the essential plan also.
So the essential plan is only for people 19 to 64. And so in like my timeline, like in my brain, which you can all tap into, right? I have like this like timeline where Medicaid really kind of straddles, the lifespan. And then they're like the Child Health Plus is 0 to 18 and the essential plan is 19 to 64. And then you kind of head into the Medicare world.
Got it. Thank you.
Sure.
So why are Cobra payments being eliminated for April through September as part of the relief package, but Medicare payments are not?
Oh, that's a great question. And that's a policy, it's like a really good policy question that I don't have an answer to. So I mean, I can tell you, so number one, it's like through the IRS, like they were the ones who put forth that the Cobra premium provision. But as far as the Medicare Part B, those premiums, which I'm assuming is what the person is asking about, those are automatically deducted from one's Social Security check. Again, there are programs that can help people with paying those premiums, and you can apply for those at any time of the year. And due to COVID, you can actually apply for them over the phone. And the only thing that you really have to document, you can self-attest to most everything with the exception of identity. And another exception at this time with applying for these Medicare savings programs is that typically applicants are required to be collecting Social Security as a condition of receiving the Medicare savings program. And there are always exceptions, but due to COVID, that's not a requirement. That requirement is suspended. I know I'm getting off topic, but I did want to just kind of say, well, there are other exceptions happening now. I know it's not what the person is asking for, and it sounds like it's not really the help they need, but I did want to put that forth.
Thank you. So this sort of overlaps food and health. What about lower cost dental services? We hear this all the time in my office, that dental care is so expensive and it correlates to health, but it also correlates to nutrition and the ability to eat healthy foods. Where can people get help with affordable dental services?
Yeah, so for starters, for some of the plans that are available on the marketplace, many of them do include dental. Thinking outside the health insurance box, if you will, there are places where you can access affordable dental care. Brad, I believe you are the keeper of a link to a document that New York City has on affordable dental services. And if you can put that in chat, that may be helpful, because there are services available in all of the boroughs.
Great. Thank you. Let's move to some of the nutrition questions. Particularly at this time with the pandemic, and people they lost their jobs, they got back part-time hours, maybe they'll get increased to more hours. So if your work hours are irregular, hence your income is irregular, how often do you have to report changes in order to not risk losing your benefits like SNAP? What are you supposed to do?
Yeah, I mean, you're supposed to provide information as things change. But with SNAP benefits, sometimes that income is unknown. So they'll do something called prospective budgeting, because they really don't want you every month coming in and saying, well, my income's different this week and my income's different this week. So they do prospective budgeting. So they'll take like the last 4 weeks and say, okay, we're going to budget your case for the next 6 months. And so they like to do it chunks at a time. And so they'll do the budget for the next 6 months. You'll do a 6-month kind of recertification questionnaire type of thing. I shouldn't call it a recert, because a recert is completely different, but some sort of check-in. It's a periodic reporting that they have to do. And they will say, okay, what's changed from this point on? And if your income is still sporadic, they will again use past information to do prospective budgeting, to have something on there. And there is a process where at the end of the year during recertification, if they owe you more SNAP benefits, they'll adjust that at that point.
Great. So we got an easy one on chat that I will just answer. Can you be a single person and apply for SNAP? Of course you can. You can be a household of one for government benefits, or a larger household. But then the question was, does pandemic unemployment count for SNAP purposes?
Right. So pandemic unemployment is more than one thing. So when we got pandemic unemployment, if you've seen Diane Wensler's presentation on it, it's more than just one thing. So there's pandemic unemployment assistance, which is unemployment benefits for those who were not eligible. They didn't meet regular traditional unemployment benefits. So that's the monthly, the weekly benefit amount. That is going to count as unearned income. Now, the extra, right, it's called pandemic unemployment compensation. So that's like in the beginning we had it was the extra 600, then it was the extra 300. So anything extra, that's the compensation piece, that is exempt for SNAP. And for a lot of government benefit programs like HEAP, cash assistance, your one-shot deals. So they're considered the compensation piece of it, the extra benefit on top of the pandemic unemployment is what is exempt.
Thank you. There's a good question. Are the Benefits Plus Learning Center information available in any other languages besides English?
No, not right now. Not right now.
And if they call those numbers that were at CSS, there are people who do speak languages other than English?
We can do Spanish, and if there's any other languages, we'll work with other members at CSS who might have connections with other nonprofit organizations that speak additional languages to provide some assistance.
And in the Navigator system, that has a number of different organizations, so probably there are people who speak multiple languages.
Yes, and if they don't have staff, then they have access to the language line, so they can facilitate in whatever language somebody requires.
Right. So unfortunately, whoever asked the question, maybe not everything is available in the written format online, but if you call these numbers, there's probably people who are going to be able to help you or find the right place for the language that you need the information in. It's the continuing goal of everyone in New York City that is usually overwhelmed by the sheer number of languages that we all speak in New York City. So thank you for that question. Oh, okay. Renters who set aside rent money during COVID were being denied SNAP because they had the money in their checking accounts. I thought SNAP was relaxing rules during COVID.
So food stamps years ago, they actually changed their resource criteria where the majority of people don't have a resource requirement. There's like 2 instances where households have to prove resources. It's if you have a sanction or an intentional program violation, or if your household has an elderly or disabled member and your income is, I think it's 200% of the federal poverty level. Those are the 2 instances. So if you're not a sanctioned household, if you don't have an elderly or disabled member, you don't have a resource requirement.
Okay, so if you were told that you weren't eligible, I recommend trying again, or reaching out for some help from one of the organizations who does SNAP assistance to double check how you answered the question when you filed the application.
And
Because my general rule is if you apply for a government benefit and they say no, assume maybe they were wrong and try a different way.
and also, if I can add, it's got to be in writing. So you have fair hearing rights. And if someone is verbally denying you, you can't request like a fair hearing. I mean, you could, but it'd be tough. But you've got to have something in writing to say that you are denied and these are the reasons why you were denied. And if you disagree with that, you have fair hearing rights.
Thank you.
I think one of the most important rules that I remember learning in benefits is that it's your right to apply for a public benefit and it's your right to receive a written determination. And I know I say it very calmly, and it's not always hard to implement that and enforce that when someone says you're not eligible, but it really is your right, and you can say this is my right. And if they're not helpful, please go somewhere else so that you get the benefits that you deserve, that you're eligible for, and that really may help you and your family.
Exactly. And government doesn't make it as easy as we all wish they did. So you could not necessarily have understood a question correctly.
Mm-hmm.
And statistically, I think well over half the people who file fair hearings end up winning them. It used to be more like 75% won them. They might still be like that. But so there's a really good chance the government made the mistake. And if you have a fair hearing, they'll reverse the decision back to the date you actually originally applied. So never forget, don't give up too easily. This is an interesting question I haven't heard in years. 5 meals a week are included in my rent. However, the SNAP application asks if I receive meals with my rent, and the only options are yes or no. Most people tend to eat 3 meals a day. It's a lot more than 5 meals a week. So how should I answer that question?
I think we need more information. We need to know if he's in a facility. SNAP has, as you remember, right? SNAP has these rules when you're in a residential facility. It depends on your age. It depends on whether you're getting SSI, SSDI benefits. It depends, right? So there's more follow-up that needs to be had before we can answer that question. And this individual can definitely give us a call, and we'll ask them those questions. Great. And see what's going on. But that is bizarre.
All right, yeah, because that's not familiar to me. But
no.
So yes, please reach out and let's see.
Yes.
Another question is about if you're paying a portion of your rent, would you still be eligible for rental payments? And none of us are the specialists in this, but we have this whole new program, the application, June 1st. My answer for you is yes, apply. If you are behind in your rent, even if you've been able to pay some of it, I do not think that will exclude you from eligibility. So please make the application, call one of the groups that are funded to do outreach to help people with those applications. And don't write yourself out of this, because I think there's a very good chance the answer is yes. Obviously, they wouldn't pay the amount you've already paid, but they could pay hypothetically the difference. Okay, some more questions. During the height of the pre-vaccine COVID, many seniors on SNAPs told me they were afraid to go to grocery stores or to buy food in person, but they all told me they could only use their cards on site in person. Is this true? And I believe you already talked about that there are a number of supermarkets that have been approved for delivery using SNAP, right?
Right. So they can shop on Amazon. They can go to Walmart, Aldi's, Price Chopper supermarkets. and purchase food there. The only thing is that if these places charge a delivery fee, SNAP will not pay the delivery fee. So they have to make a separate transaction to pay for any delivery charges from these supermarkets.
Got it. So how do I get SNAP for my mother? I'm assuming you just help them fill out the application with her information, assuming she's not living with you. If she's living with you, then you have to remember those household rules.
Mm-hmm.
So if you're shopping and feeding her, you're probably a household together. If you don't live with her, then you could actually help her apply for SNAP, and you could shop for her.
Mm-hmm.
And is there any other rule I should remember about this?
Yeah, no, that's really good. You remember everything.
I think it's,
I'm doing this as a test.
It's her CFRC days.
Right.
I think just one more thing is just to remember in which county your mom lives. If she lives in New York City, it's all good. But if she lives in a different county, you'll want to make sure that you apply through the appropriate entity.
Oh, that's exactly right. We're very Manhattan centric here. We just assume.
I get it.
But you're absolutely right.
But you can, but this also, is a good opportunity to talk about an authorized representative. So you can have someone that is outside the household get their own EBT card, because I hear this over and over again where people, oh, take my card and do shopping. Well, you can be an authorized representative, get your own card, get your own PIN number, and help that individual shop for their food. And then once that relationship is over, the card gets canceled and you're still protected, right? Because you have your own EBT card still. So authorized representative is the way to go.
Particularly if you've got a home care worker
Mm-hmm.
and you're asking them to be able to go food shopping for you.
Right.
You definitely want to have the option where they've got a separate PIN. And if your relationship ends with them, you end their access to your account. That's excellent. Right. Remember, That's excellent. Thank you. How are recurring income sources treated for SNAP? The person asked about capital gains, interest income. Is it work? Does it have to be reported for SNAP benefit eligibility?
I would imagine so. Those are not exempt resources, right? So even though there's no resource requirement, the interest that you gain from that is considered unearned income.
I think I remember the exact same rule.
Okay.
All right. Now
we're going to go with that.
Well, sometimes the rules change. Just for the record, people, I haven't done food stamp SNAP for 20 years now. So
and not much has
changed.
Not much has changed. Even with COVID, I was actually surprised that they didn't do like additional changes with SNAP. That really surprised me. But SNAP is really the same. They were lenient with documentation and application process, but they really didn't change SNAP all that much.
Mm-hmm. Okay. Are benefits ever provided retroactively? I think it would be a hard one for health, but for yes?
Well, it depends. Okay. I mean, oh my God, I love that. I love these questions.
Yeah.
I love trivia, by the way. I'm not very good at it, but in health, I'm like, okay. So, so for Medicaid, for people 65 and over, disabled, blind, you can actually get Medicaid 3 months retroactively. That's number one. For the Medicare savings program, some of them, yes, it's an it depends question. It's an it depends. For Medicare Part A, you can get that up to 6 months retroactively, though not before your eligibility date. And Part B with very few exceptions. I would say the general rule would be no. And then everything else is prospective, as far as I'm able to get on off the top of my head.
And with SNAP benefits, it's retroactive to the date of your application.
To the date you applied.
Mm-hmm.
Right, but you can't say, I've just learned about this program and it looks like I was eligible for the last 3 years.
But I think the question that we had before, who was verbally denied, right? It's in their best interest to fight that, because if they are indeed, they win their fair hearing, they get those back benefits all the way back to the application.
That's right. And even though this is not a benefits discussion on all kinds of housing benefits, I will just highlight the program that the City of New York now calls the Rent Freeze program, but is legally the SCREE and DREE program for elderly and disabled tenants. who are below a certain income and live in rent regulated housing, those benefits are retroactive to the date you apply. And sometimes the city has taken 6, 7, 9 months to process, but they will be retroactive to the date you apply. So I guess one of the rules here is when in doubt, apply. It's not the end of the world if you don't get accepted. If you think that they're wrong and you're right, fair hearing, getting more technical assistance from one of these many community groups who are designed to help you. Apply again, because you might have applied at a time where you were just above the eligibility, but now time has gone on, numbers change each year, and at this moment in history, you could be eligible. So you don't want to write yourself out of any possible eligibility, even if you were once not eligible, right? So, never say never. And this brings us to exactly the time that I was supposed to thank you both profusely for being with us tonight. And I really do sincerely thank you both for coming out, giving us all this great information, all these good sources of information that we can use for ourselves and others. And again, Michelle Berney, Leslie Bailey, Community Service Society. Our next event, which we have not scheduled exactly yet, that's usually I can tell you dates, but we don't have it yet. But it's a complex and important topic of the growing issue of racial hatred and religious intolerance and bigotry that we, I don't know, just assumed wasn't really our issues in New York City. It was those other people, other places. Well, guess what? Those other people are here also, and we need to learn better ways to confront these problems and to educate our children on the reality of our being a pluralistic country, a pluralistic city, where we're all this complicated but blending melting pot. So I look forward to participating in that town hall with you at some soon future date. Again, get vaccinated. Tell everyone you know to get vaccinated. And even though the masks apparently can come off more of the time now, if you're more comfortable with the masks, wear the masks. Keep your social distance in large groups and really think through. You may know you're vaccinated, but other people might not know, and other people around you might not be. So let's just keep safe and smart. And thank you, everyone. And thank you always my staff who really do all the work for these events. I just roll in to talk at the end. So good night. Take care.